Welcome to our channel. If you need to access women's health services in the United States, follow these step-by-step instructions to find comprehensive and affordable care. Step 1. Find a gynecologist or women's health clinic in your area. Ask your primary care doctor for recommendations or search online directories for providers accepting new patients. Step 2. Check if your insurance covers women's health services. Under the Affordable Care Act, most plans must cover preventive services like well woman visits, contraception, and screenings at no cost. Step 3. Visit Planned Parenthood or similar reproductive health clinics. These facilities offer affordable services on a sliding fee scale for those without insurance or with limited coverage. Step 4. Schedule an annual well woman exam. This preventive visit typically includes a physical exam, breast exam, pelvic exam, and pap smear if needed, usually covered at no cost. Step 5. Ask about contraceptive options during your visit. Most insurance plans cover birth control methods without copays, including pills, IUDs, and implants. Step 6. Get screened for sexually transmitted infections regularly. Many clinics offer free or low-cost STI testing, especially for those without insurance. Step 7. Access pregnancy-related services through your healthcare provider or local health department. Prenatal care is essential, and many programs help pregnant women get coverage. Step 8. Look into community health centers for comprehensive women's services. These federally funded centers provide care regardless of ability to pay and offer services on a sliding scale. Don't forget to like this video and subscribe to our channel.